There are so many medications for hyperlipidemia. If anyone takes a prescribed medication, ask your pharmacy or doctor, what kind of medicine do I take? Drug-induced nutrient depletion is a key concept for those who take medicine to treat a chronic disease like hypercholesterolemia. For the treatment, statins are a common class of drugs prescribed to lower cholesterol levels and reduce the risk of cardiovascular events. While these drugs are generally effective in managing cholesterol levels, they may also have some effects on nutrition levels in the body. We need to check this depletion caused by statins. Coenzyme Q10 is running out while you are taking statins. Statins can reduce the levels of coenzyme Q10 in the body. Enzymes in the liver are involved in many complex processes of making cholesterol. During this cholesterol synthesis, coenzyme Q10 is also produced through similar pathways. But statins block this liver enzyme, specifically called HMG-CoA reductase, necessary for synthesizing not only cholesterol but also for coenzyme Q10 synthesis. That is the reason why coenzyme Q10 synthesis also stopped and depleted by statin medications. As a result, there is a significant shortage of coenzyme Q10. In the study of atorvastatin, one of the commonly used statin medications, coenzyme Q10 levels in subjects were greatly decreased by 49% after 30 days of atorvastatin therapy. Coenzyme Q10 is an antioxidant that plays a crucial role in human body, highly concentrated in the liver and the heart. It generally helps the cells to produce energy through metabolism. And as a powerful antioxidant, coenzyme Q10 protects blood vessels, removing free oxygen and preventing lipid peroxidation. Due to activating nitric oxide synthesis, it relaxes vascular endothelial vessels and leads to lower blood pressure. Lack of coenzyme Q10. There have been various adverse effects, most commonly affecting muscle pain and a rare muscle disease called rhabdomyolysis. If you take this hyperlipidemia drug for a long time, you may feel weak in your muscles. Therefore, long-term use of statin can affect cell energy generation, blood pressure, and heart functions. Supplementation of coenzyme Q10 may be beneficial for individuals taking statins. It is better to take about 100 mg a day. If you use a lot of energy using muscles, about 2 to 300 mg is recommended. It is also important to consult with your healthcare professionals before starting any kind of supplementation. Vitamin D is crucial for bone health, the immune system, and many other things in the human body. But with statins, this essential nutrient level may be reduced. There are some evidences suggesting that statins reduce vitamin D levels. The mechanisms are not yet certain, but it has been proposed that statin potency may play a role. Vitamin D is essential to keep bones strong while helping calcium to be absorbed into the bone. Long-term statin therapy may reduce the density of bone. So, regular monitoring of vitamin D levels and supplementation, if necessary, may be recommended for individuals on long-term therapy. Low vitamin D concentration may be considered a modifiable risk factor for muscle-related adverse effects of statins. Synthesis of vitamin K2 may be bothered by long-term statin indication. Vitamin K2 helps bones and prevent arterial calcifications. It is a collection of calcium in these heart's two main arteries. Since statins inhibit the synthesis of vitamin K2, the cofactor for protein activation, which in turn protect arteries from calcifications, which can lead to heart failure and atherosclerosis. To prevent this, it is important to maintain a balance of vitamin K2 while taking statins. Magnesium is important for muscles and nerves and for maintaining a healthy heart rhythms. Statins bind to fat, which are necessary for mineral absorption, and for that, statins intake may lead to decreased magnesium levels. The connection between statins and magnesium is somewhat complicated. Both can inhibit the same enzyme, which produces cholesterol. So, while treating with statins, insufficient magnesium also could make treatment harder. There are some evidences that statin may reduce serum folate levels. Folate is essential for DNA synthesis and repair, and its low levels can have implications for overall health. Monitoring folate levels and considering supplementation may be needed. Like statin do, other drugs for hyperlipidemia also reduce essential nutrient. There are fibrate-based drugs that lower triglyceride. These deplete vitamin B2, B6, B12, and zinc. A drug called cholestyramine binds to bile acid and causes cholesterol to reabsorb and be eliminated. Bile acid contains a lot of fat-soluble vitamins. Bile excretion caused by cholestyramine eventually inhibits the absorption of fat-soluble vitamins, beta-carotene, folate, and iron. What kinds of nutrients are helpful while taking drugs? It's calcium and magnesium. Calcium inhibits intestinal absorption of fat. Magnesium binds to fat to expel it from the body. And omega-3 intake may lower triglyceride and increase HDL.